Hello, I am grateful to Dr. Price's invitation to create a small introduction for therapists at your site as to the applications of Tai Chi that I understand help people in cardio and pulmonary distress. One of the things that's very clear about the exercise approach from Tai Chi is that it softens the soft tissue. Now, I know you may not have a massotherapist on site, but these movements actually massage the body and also opening softly the chest cavity and the back. Please move with me so that as I'm describing the application, you can feel it. So, given a chance to open the rusty gates, many of the pulmonary patients that I worked with, it was a 2-year study in Cleveland at Southwest Hospital, and the people with COPD were so tight in the shoulders. And all I describe to people is the X's and O's of motion that can soften and open the rusty gates. Now, this may also help some of your own tension, I hope. And if you're moving with me and you play this circle 3 or 4 times one direction, 3 or 4 another, and then drop your hands, that's one way to compare the arms and see if your patients feel the difference. And that's one of the things I really apply in my class. If there is a conscious search going on about feeling where the tight spots are, and that's the phrase, open the rusty gates. Obviously, there's more yang, work, followed by yin, relax. So that in the process of stretching, the entire body experiences turn on, turn off, and breath in, breath out. One thing that all of my students notice is that as they age, things begin to shrink. And you know this posture, you've seen it. What a compression for the lungs and the heart. So opening the rusty gate can be an immense gift. And if you're swimming like this, hug or breaststroke. You can feel the massage going on internally, and I really hope that you'll try this for yourself. And if there's an application you come up with that involves slow motion, you are definitely in the genre of Tai Chi. Now, for the chin and neck, this kind of a ripple, north and south, and we'll do an east and west that's a little different. But this massage front to back is extremely great gift. Now, if you add the shoulders and elbows flaring, chin up, chest out, hang, pull in breath, breathe out. So I'm going to create a video also for your clients in case they want to try it. And for a period of time longer than you might stretch at home, let people check whether they feel a difference. Now, obviously, the lower back is connected to the neck and shoulders. The moment you turn the entire thing into a ripple. So this is the north-south axis. Now for east and west. Grab the chair. I got a picture of the chairs you use in your clinic. And if you'll grab the chair underneath and hang, wiggling the neck softly is creating a stretch on the opposite shoulder and also a deep relaxation training for this arm. So hang, move the head to an angle where you feel a compression. This can also help migraines, neck tension, and please assure them that the little noises are safe, as in soft tissue loosening up. So the muscles are sliding instead of being stuck together. So those adhesions affect every part of the body. When they come up, please ask them to compare the side that was stretched with the other side. The moment people feel a difference, they can say, this might work. So motion is medicine, you know. One of my experiences within the Cleveland area was to observe for 4 months a dear friend who was in physical therapy at the VA, and his PhD therapist was extremely gifted at getting him to notice what was going on and see if it was worth repeating. And that's one of the things that I really recommend. If the swimming of the head, that if you're doing this yourself and you're hearing noises, every click is a thank you. Now, rolling the shoulders, we know, rolling them front, rolling them back. The moment you add a larger arc for the elbow, front to back, you're getting a much deeper massage down the back. Turn and follow the elbow. And after 3 or 4 loops, reverse it and go the other way. And breath in on the rise, breath out. Breath in, breath out. And then compare to the other side. And the other side usually says, me too, please. Circle one direction and do some wiggling of the neck, slowly, swimmingly at the same time. And the motion up can be felt clear down to the hips. And anytime there's an excuse to extend the back, you are stretching the tissue, obviously. And then when we go opposite direction or east and west. So turning from side to side is also a way to massage the inside of the spine. And grab the back of the chair, and if you will lean forward, and again, explore angles for the neck, and then hold tight and lift the arm. And when it's out, a lot more information can be gathered. And the moment you are getting a patient to say, where am I tight? What am I feeling? They're on board to correct some of their rusty spots, kinks, tight spots. And the nice thing about the word tight is it has an opposite called loose. And that can be connected to people. And now extend the arm, hold tight, and you feel an extra stretch on the back, down the shoulders. So in terms of everything about your opening the rear rib cage, the front rib cage, and being able to be more pliable, not only does it improve balance, but it improves breathing. Obviously, if everything is compressed, where's the breath capacity? So making it easier to breathe is some of the feedback I've gotten. The other assignment I had within Cleveland was 10 years at the Cleveland Clinic in chronic pain rehab, pre-COVID. Unfortunately, that program no longer exists, but what they did was take people off their meds. And what I did in Tai Chi with them was let's find the tight spots and loosen them up. So that's where the Chinese phrase, open the rusty gates. So what would you do with a shoulder if you woke up funny in the morning? You'd mess with it till it feels better. So this is the lubrication massage that everyone can do on the inside if they're invited to find their tight spots and they can feel the release. Good. There's liable to be compliance and follow-up at home. So I really invite my students to sit in a chair and check where you're tight. Now we've been doing north-south this way. You can also hold a knee and go opposite angle. And this is the same ripple, chest out, chest in. Now, if you're doing this with me, and I hope you are, this will give you an excuse to stretch your own back. And of course, everybody who's ever had back pain has ended up sitting this way to loosen the stack of bones. And lumbar 3, 4, 5 are actually maneuverable if you play around with the edges, which is the soft tissue. Now this is, of course, wagging your tail, And I hope that feels good. And also reaching across again and across again. So the reason I'm repeating this is I hope you're playing with me. Play the Tai Chi. And the motion that you get giving breath in, breath out is turning on the energy. So whether or not you believe in Qi, the energy, realize that our Western medicine connects with Chinese meridians, channels, the heart channel in the left arm when gentlemen have a heart attack and shooting pain, by softening the soft tissue in the shoulders and arms, the heart channel, and also up here, lung channel. So there's the pulmonary part, and lung channel, heart channel. The acupuncture approach or acupressure approach, and if you want to feel it yourself, grab the bicep here and put your fingers in the ditch. You'll feel one of the lung channel spots along this edge. And if you're giving yourself a chance to think broadly and integratively, loosening the body is going to let the energy flow better. So if it also makes breathing more efficient and relieves pressure on the heart. One of the constant go-tos with Tai Chi is that it lowers blood pressure. I want you to feel this. Go tight for a moment. 3, 4, 5. And now chill. And if you feel a buzz in the fingers, you've lowered your blood pressure. And lifting the arm, lights on, lights off. Lights on, lights off. And this slow breath for the muscles, breath in, and now bring the hands off to the side and pretend you're pressing a silk curtain, so not tight. Obviously, this is the opposite of American exercise, not to make people more tight, but to loosen up everything, so that the breathing and the flow of energy is more efficient. So that's my pitch. And also, if you are able to get some patients interested in this, the whole thing will be seated, maybe with one exception. I'll figure that out when I do the video. So thank you very much. And please feel free to send questions through Dr. Price. And I will hope this is useful to you and to you personally, if you're tight, and who isn't these days. Thank you much. Bye-bye.